welcome once again to another episode of Marvelous Medicine. I have a great pleasure in inviting Dr. Vijay C Bose, who's the Joint Director and Consultant at the Asian Joint Reconstruction Institute, Chennai. He did his MBBS from MMC, and I think he's a classmate of Selvi. He did his MS Ortho from Mangalore, MCH Ortho from Liverpool, and also his FRCS from UK. His special interests are arthroplasty in young patients, hip resurfacing, and partial knee replacements. And he has a huge body of work to his credit. He's a sought after speaker in national and international fora and has done several live surgical demonstrations of both hip and knee arthroplasties. Dr. Vijay is a keen tennis player and is a proponent of intermittent fasting, and we look forward to hearing his protocol for health and fitness in this difficult year. To moderate the session, we have Selvi Radhakrishna, who's a consultant breast surgeon and runs the Chennai Breast Center. She did her MBBS from Madras Medical College, Chennai, her DNB from surgery from Railway Hospitals, and her FRCS from Edinburgh. To give a extra focus on the diet angle, we have Dr. Vinita Krishnan joining us. She's the chief clinical dietitian at SRM Institute for Medical Sciences, Chennai. She has done her MSc and PhD. She's a qualified internal auditor for ISO, JCI, and NABH. She has research work to her credit. She has authored a book titled Nutritional Planning for Practicing Dietitians and has also compiled a cancer diet therapy manual for adults. Normally, we ignore the vernacular and all our publications are in English, but Vinita has published a book in Tamil as well for diet therapy for common diseases. I welcome all three of you once again and look forward to a good discussion at the end of the talk by Dr. Vijay Bose. Over to you, Dr. Vijay Bose.
Again, start the talk?
Yes, sir.
Okay. So the talk is a comprehensive scientific template for health, fitness, and wellness. Now, this is not some kind of a magic formula where suddenly we follow this template and we all get very healthy and fit. It doesn't work like that at all. Yeah. We tell somebody that this is the things that you must do, must not do. This is a yes, no, good and bad. It's a sure way of ensuring that people never follow what you say. So the focus of this talk is going to be just highlighting principles, understanding the science behind what we do, and it's up to each one to decide whether to follow it or not, and what to choose, what not to, all left to the individual. But the basic idea is to make people understand the concepts behind what we are talking about. That's going to be the thing. Now, this talk, Pata said, is to be aimed on doctors. I do appreciate that there's going to be some people who are not doctors. I try to tone it down to, try and remove all the technical terms. But if something creeps in, please do excuse me for that. So with that intro, I will start the first slide. So we all know health is wealth. It's good to be interactive. Pata can, the question is, what is health? Pata, just for starting off, what is health, Pata?
Health is a physical, mental, spiritual, economical, financial, sexual well-being.
I think it's the wrong person I asked. Anyway, so, most doctors would think, I'm sure you'd all agree with that would say absence of disease is health. That's what we tend to focus on. And then if you ask doctors, how do you find out whether you're healthy or not? 99% out of 100 in India at least would say that you do a master health check, MHC. MHC was invented by the Apollo group here in Chennai, and is now, of course, a rage all over India to do MHCs for so-called health. Now, the first fundamental point is that it is wrong to think that absence of disease is optimal health. It's completely wrong to think that, although most doctors have this view. Now, we have been, as doctors, we have been wearing blinders, and we have been total tunnel vision that we have. The only thing that we see is disease, disease, disease. We never see outside that spectrum. And therefore, all our focus and our thinking is all through the prism of disease. Now, there are a lot of things outside that I think we must be aware of. And, you know, we were never taught this in medical school. In medical school, we were only taught about disease and ill health. We never talked about fitness and health. So we cannot blame us, but I think it's time to focus outside of disease. Now, this is the current allopathic view of health. Now, Dr. Devi Shetty is icon of Indian medicine, a great inspirational figure, and I've been inspired by him a lot. However, when Saurav Ganguly had this heart attack, Dr. Devi Shetty had gone from Bangalore to Delhi to treat him, and then he gave his interview. It was a good chance for him to highlight the importance of health. But what he said in that, sorry, not the interview, in a press meet, when he came out of the hospital, when all the media were there, he said three things. He said, Saurav Ganguly is only 48 years old, fit, does not smoke or drink, and does not have any vices. I don't know what he meant by that. The only thing that could have prevented him from getting a heart attack is undergoing a preventive CT angio at regular intervals. So Saurav Ganguly, who doesn't smoke or drink, is 48, fit, still has a heart attack. So if he can get a heart attack, anyone can. That's exactly what he said. So the message was, we must all do preventive checks and CT angios at frequent intervals, and that's the only way you can prevent a heart attack. I mean, how tunnel vision can we be? I mean, this is the epitome of tunnel vision. And if somebody who's an icon, Dr. Devi Shetty can say this, and I'm sure rest of the doctor community also have the same view. Now, the question to ask is, what is optimal health and what is health intervention? We all know about disease intervention. All of us or most of us here are specialists in various fields and very, very good at intervening in various interventions we do for various diseases. We are top class, top notch. But when you talk to a doctor on what is health intervention, everybody asks me, health intervention. What is health intervention? Never heard of that before, although they have been doctors for 30, 35 years. So the population of a city or a community can be compared to a classroom. Okay, so the 15% of the classroom or the community, if we do an MHC, they will get fail marks. And they need some kind of sickness intervention that we do all. They may need a gallbladder surgery, they need a knee replacement, they need a stent, whatever. So that 15% will need intervention. And that's the focus of MHC, to find out that 15% whom we can intervene on for their sickness. That's fair enough. That's the only 15% of the population. There's another 15% which will be excellent. Unfortunately, the MHC makes no attempt to find who is excellent, and they do not need any intervention at all. So 15% need sickness intervention, 15% do not need any intervention. However, the vast majority of us will be in between, 70% of them. And we will have a pass mark in MSc. We'll say our MSc is great. We got a textbook normal range of many biochemical values, and we are told that we are healthy. But this is not health at all. This is only an average, only a student in a classroom who just made a pass. He's not good. He just made a pass mark. He's not good at all. He doesn't have optimal health. He just is okay with the pass mark. And this is what we have been calling as health so far. What a tragedy it has been. Absolute tragedy. I think the time has come for us to reflect on that. So what is scientific health intervention? The 70% you must have been in their health intervention, not sickness intervention. Health intervention, and therefore they will reach optimal health. They will reach to the standard of the 15% who are already excellent. And that is what we mean by scientific health intervention. So what is the difference between disease intervention and scientific health intervention? So disease, I can see that there's a, disease we all know. There's sickness, the drug therapy, we do surgery and all that. That is, and the whole hospitals and doctors focus on this 15% all the time. That's what our entire focus is on. It's okay. But what is wrong is to call this middle zone, the 70%, as normal, or they are very healthy. They are not healthy at all. That's only a pseudo wellness. They are not healthy. So we come to health intervention. So the 70% will need health intervention to make them good or optimal health. So now we know exactly how to do that. So we rely on two things. There are some key metabolic parameters: the BMI, fasting blood glucose, fasting insulin, HbA1c, HSCRP, the atherogenic lipid, not LDL. We're not interested in LDL. I'll come to that a little later. We want to measure the ApoA, ApoB. We want to do the LFT and ultrasound abdomen, blood pressure. These are the metabolic parameters that we have to work on. And then there are key fitness indices. It's completely ignored by MHC. And we have various fitness indicators like the RHR, waist circumference, VO2 max, plank time, BFP, muscle girth, balance score, flexibility score, sleep score. And this is what we want to intervene in everybody, health intervention, to make them optimal health. Now, nobody in MSc talks about it, no doctor talks about it, and it's time for us to reflect and see how we can make good health intervention. So now we know exactly what to do. There are key metabolic parameters which have to constantly, all of us have to work on to improve them. And we have key fitness indices we have to improve on. Just because you get a normal range or a textbook normal range, it doesn't mean that you're healthy. And this is what we mean by health intervention. Quite different disease intervention. Now, our present concept of wellness in allopathy, I'm sure if I ask all the doctors here, what is their interpretation of health? How do you be healthier? If somebody asks advice, a patient asks, doctor, how can I be healthy? Most would say that you take a multivitamin every day, you take an aspirin every day, you take a calcium and vitamin D every day, you take a statin, you take a H2 receptor antagonist, you take a cod liver oil capsule, and any antibiotic at the slightest suspicion of intention, do CT angio and MSc at regular intervals, and we give generic advice saying, don't smoke, don't drink, eat less, move more. That's all that we give. That's what we are. This cannot be more far from health intervention. This is exactly opposite of health intervention. This is exactly what one should not be doing. But that's the advice that we dish out day in, and I'm sure if you all touch your heart and say, we have all been doing this for years and years. So this is just what you should not be doing. Because allopathy gives scant importance to wellness and views it the prism of expertise in the treatment of diseases. So we all are experts in treatment of diseases, and therefore we view the entire health through the prism of disease. It's a completely wrong view to have. So if you look at the 2021, how healthy is the world's population, including that of doctors, and if you look at this graph, chronic illness, diabetes, respiratory cancer, cardiovascular disease are all going up, or in short, lifestyle diseases. Whereas all other things, injuries, communicable diseases, are all coming down drastically. Not only that, we see acute interventions, whether stroke intervention, MI intervention, degenerative diseases, joint replacements, congenital diseases, intrauterine, we are now able to intervene. Transplant medicine, oncological interventions have gone sky high. We do so well in that. And our science has developed so much in the last few decades. If that is so, our lifestyle diseases also must be getting better and better, isn't it? But quite the contrary. Lifestyle diseases are just skyrocketing. Our impact on lifestyle diseases have been the reverse. All other diseases, we have made tremendous progress. Whereas lifestyle diseases, we are degenerating, year by year. And if you see the unrelenting march of diabetes, I believe 1 in 4 or 1 in. So if we look at this one article from the Lancet, for 95% of the world's population has got lifestyle diseases. A lot of people have more than one. They have 2, 3, 4 lifestyle diseases. And if you compare from 1960 to 2020, we have gone, for lifestyle disease, we have gone more obese, we have developed hypertension, heart disease, diabetes. We are really down on a slippery slope. Although we have made excellent progress in all other fields of medicine, we have gone on a slippery slope as far as lifestyle diseases goes. Now, the interesting thing is our ancestors didn't have so much of lifestyle diseases. In spite of all the scientific progress that we have had, we are on this very sticky slope. The question I'd ask is, somebody has given an answer. Why, with all this, developments in science, why we have, made such a bad turn as far as lifestyle diseases go? There has been a strategy in the last few decades as doctors, as allopathic doctors, to achieve health. We told patients you had to eat less, you had to move more. Instead, you had to eat fat-free, low fat, don't include fat in your diet. Eat small portions frequently, and that's what we have been telling them. You cut your calories. And once you produce caloric deficit, your weight will come down, and then you will become healthy. That's what they've been dishing in and day out. Now, this strategy has been an unqualified failure. If you compare from 1960, where we are far more healthier as far as lifestyle diseases goes, to 2020, in spite of giving this advice, the population has sunk into a disease of chronic lifestyle illnesses. So now this approach that we have had over the last 5 decades has been unblemished by success. It's a perfect 50-year failure record. So the first thing that we have to do is not admitting a mistake is a bigger mistake. Robert Half said that. Not admitting a mistake. So it's time for us to accept this mistake and say, hey, last 2 years, what we have been advising patients is completely wrong. We have a relook at the whole thing. So the first thing that we have to understand is that why we have failed is that any type of diet that you advise a patient or a colleague or somebody in the family that leaves the person hungry is doomed to fail. You may have a diet pattern for 1 month, 2 months, 3 months, but that is doomed to fail if you leave the person hungry. So all these things we have used in the past, all these powders which medical rep gave us and we gave to our patients, you do with powder. These are all meal replacement powders. So instead of meals, you take that. They did lose wealth, but these are extremely, extremely unhealthy. Now, if you produce a gross calorie reduction and patient is hungry, you will put the body on a conservation mode. And then when the patient is very hungry, he starts to take calories, and the body will absorb it like a sponge. And then he will gain weight much more rapidly than what he used to. This we call as fat overshooting. Fat overshooting is very, very bad. And like a yo-yo, people who undergo fat over, typically they are on a starvation diet, and then when they come out of it, they overeat, and then they go into fat overshooting. This is very unhealthy fat, very, very metabolically unhealthy thing to do, to go into fat overshooting. So never advise anybody a diet which will leave them hungry. And that's the first mistake that we made, the first mistake that we should not make. What about these intensive weight loss retreats? We told them you go to Kerala, a lot of resort there. You go there, you do some yoga, you have some excellent diet, you do meditation, and you lose. Well, true, you lose weight. No, so you live like a hermit for a few weeks, you lose weight rapidly, then you come back home, you put weight back on as quickly as you lost it, and quickly. This is the yo-yo dieting. This also is very bad. A lot of people that we know, temporarily they're okay, and then this is never going to work in the long term. What about all these fat diets that we hear about? A lot of fat diets. So what's a fat diet? A fat diet is a diet that promises quick weight loss and usually require you to eat one specific type of food. You have to eat only protein, paleo diet, Atkins, keto diet, whatever it is. Eat only that, don't eat anything else, and then you will. Remember that fat diets don't work. Again, the same things. You can be on a fat diet for a specific period of time, but you cannot hold on to this. Again, is very unhealthy. So remember that quick fixes don't work. Understanding the science behind it is the only way to go for long-term success. So we got to understand the science behind that. So that's where the template comes from. The first thing about this template is that the weight loss is not the goal. Weight loss is a byproduct of adopting a healthy lifestyle. This should never be the goal. If weight loss is your goal, then your aim is not to be healthy, just not healthy. So the wrong goal that we have been targeting. Weight loss, it'll occur automatically as long as you have all this. So now we have this template. We have this health intervention that I told you about. So we have primary health intervention, secondary health intervention, and tertiary health intervention. So why we classify the intervention into primary, secondary, and tertiary? So you must not go into secondary before you complete the primary, and you must not go into tertiary before you complete the secondary. So the order of importance. So what is the primary interventions? We call it 3M or 3 macro diet intervention and hydration, fasting. Then we have what we now call the scientific 4D exercise program. 4D means the 4 dimensions to a scientific exercise program. So all these are important for the primary intervention. Secondary intervention has 3 things. You have to optimize your sleep, you have to improve your breathing techniques, and you must do stress reduction. And third thing is, you must have sunlight, you must have some kind of a brain workout, you must have clean air. All these we tend not to give importance, but important. So primary, secondary, and tertiary. The full template looks like this. This will look complicated, but it'll look easy at the end of the talk. So first thing we talk about diet, primary intervention. So when we say that, we say you must get out of this mindset of thinking that only smoke and drink are detrimental to health. That's what we've been telling patients. Don't smoke and drink, and then you are healthy. That is such a wrong mindset. We can cause a lot of damage to the body by food. In fact, it can cause more damage than smoking and drinking. So how we can cause damage to the body by food? By what we eat. There are direct toxins to various organs we can eat, which you should not. because the low-grade inflammation of the body can derange the favorable gut bacteria, the microbiome. You can cause derangement of that. You can have intolerance or allergy. This is how what we eat. When we eat, wrong timing of eating and constant feeding, we damage the body. Then how we eat, inappropriate hormone response by eating the wrong foods, wrong proportion of constituents, the proportion is wrong, a pace of eating, all this will damage the body. And this damage is far more than you ever thought of, and probably more damage than smoking and drinking. So, Anne Wigmore's famous statement, the foods you eat can either be the safest and the most powerful form of medicine or the slowest form of poison. There's nothing more true than that. So can the bad food we eat more harmful than smoking? It appears to, most likely yes. And a lot of studies now to say that actually your food can actually be much more harmful than smoking tobacco. Published articles in very reputed journals like Lancet. And if we talk about, and the first thing that we like people to follow is to talk about sugar, processed sugar that we eat day in and day out in our coffees, in all our meals, in our sweets. So this is a book by John Yudkin, and he calls processed sugar that we eat every day as pure, white, and deadly. This pure, white, and deadly is a term that's used for cocaine. Now, what he's trying to imply is it's as deadly as cocaine, this processed sugar. So John says that if only a small fraction of what is already known about the effects of sugar were to be revealed in relation to any other material used as a food additive, that material would promptly be banned. So just like how you ban tobacco, this is in the same same league, this processed sugar, but there's nobody who's not eating it, and we eat it a day in and a day out basis. Now, it's shocking to find out that the ill effects that just like we say, smoking can affect from the hair to the toe, sugar can also, right from the brain to the joints, to diabetes, to appetite, to heart, to liver, to uric acid, to clog arteries, everything processed sugar can got. And one of the main culprits of metabolic syndrome. Now, the metabolic syndrome that we refer to again and again, or some neurodegenerative disorders, Alzheimer's, now it is called as type 3 diabetes. Now, type 2 diabetes, which is mainly dietary, polycystic ovarian disease, non-alcoholic liver failure, very common in our population, cancer, stroke, cardiovascular disease, depression, body aches, pains, and myalgia that we see in our orthopedic OPD. All are the same disease presenting in different departments, hiding as different entities, but they're all metabolic syndrome or more subtle metabolic derangement. And the sugar is one of the main culprits of that. Now, if you think, okay, I'll stop sugar from today onwards, that just won't do, because the sugar comes in many, many hidden forms. There are a lot of other names which companies use to package. They don't call it sugar, they call it lots of other things. And the most important thing that you must look for anything you buy is high fructose corn syrup. That's a deadly thing, but is present in, today you open your kitchen cabinet and see in 90% of that, it will have this HFCS, that's high fructose corn syrup. So it comes in so many hidden forms. So you got to take care and avoid all this, because it's like smoking, basically. We eat this, is like smoking. And somebody comes to you, your patient comes to you and say, Doc, I want to be healthy, tell me what to do, but I'm going to smoke 1 pack of cigarettes every day. That is I'm going to do, but tell me how to get healthy. What do you tell him? You tell him to get lost. You can't get healthy. Now we eat all this and then you cannot be healthy. So these are the dangers of the high fructose corn syrup. Absolutely a deadly substance, but present in most of the packed goods. Now, people have compared smoking and sugar addiction exactly the same. Exactly the same things will happen. You will start craving for it, and the same stages. First, you'll feel motivated to give up sugar, and then you'll have cravings will start to kick in, and then symptoms will peak. And then only you have to get through that symptom peak, then you can really give up sugar. And then only you start to. So same as smoking, the same thing, sugar withdrawal, you go through the same symptom. So smoking and sugar, exactly the same. Probably sugar is slightly more dangerous than smoking. Now, what can you do? Alternatives. Never use anything that is synthetic alternative to sugar, whether it is your sugar-free, they contain worse substances. And all this Demerara sugar is just molasses added to sugar. So don't use all this. However, natural products can be used in limited quantities. Whether you talk about karupati, vellam, panakarkande, coconut palm sugar, raw honey, pure maple syrup, which nature has given us, they are good. They do not harm the body. It's like cigarettes, you want to use something which does not harm your body. These you can use. But anything artificial, you are puncturing your body just like what you do with a cigarette. So next we introduce the concept of clean eating. So what is clean eating? You avoid food that damage the body and not counting calories. So we say do not count calories. Once you start counting calories, you have been advising patients for the last 50 years, it surely is not going to work. You say you take 600.5 calories, that's not going to work. So no counting calories. We want to just eat clean. That means don't take food that will puncture your body like a cigarette. So if you find direct toxins to various organs, all these will cause problems. Don't take any food that will inflame your body. Don't take any food that will cause derangement of the gut microbiome. And you find what are the foods causing that. Surprisingly, there is a common elements. They're again same thing. It's not rocket science. It is refined sugars, processed foods, fast foods, packaged foods. Again and again, the same culprits keep coming again and again. Refined sugars, processed foods, fast food, packaged foods. Whatever may be the mechanism through which they act, that is okay. So the next concept that we introduced is the good calories and bad calories. That's a very important concept. So earlier we thought a calorie is a calorie is a calorie. Last 50 years, so we told patients you cut your calories, you produce a calorie deficit. That's the only way of getting healthy. Now that has now been questioned, and I think we must change it. And that's one of the reasons why we failed miserably. So different foods will have different impacts on the body, though the calorific value may be the same. So the new concept is that the new school of thinking is that there are good calories and bad calories. I told you earlier what are the good calories, what are the bad calories, and how they damage us. So as long as you're eating good calories, you don't have to count the calories. You can eat whatever you want as long as they are good calories. And this landmark book by Gary Chops, Good Calories and Bad Calories, highlighted that important fact that don't think a calorie is a calorie is a calorie. It's not. Good calories are completely different from bad calories. Now, these are examples of good calories and bad calories. So what is real food, clean eating? Now, the food companies, the multinationals which sell us all this food that we eat day in and day out, how food companies cue the signs of what we eat. So just like anything else, they influence us in various ways, and they have the pseudoscience telling us this is healthy, that is healthy, all doctored studies, and we all think that, that is healthy. So what is slow poison? So how to identify a food is slow poison or a bad calorie? It's produced in a factory and sold in neat, convenient packages. It's always the same. There's no quality or taste variance from one pack to another. Stays fresh for extended periods of time. Long shelf life. No preparation is required, only microwave or heating. It contains artificial colors, additives, preservatives. It is artificially flavorful, usually contains sugar in some form. No real connection or link to local culture. Now reject all these. These are all slow poisons. So how do you find real food or good calories? It is grown and sold whole. It's variable quality. It spoils fast. It requires preparation usually. It's vibrant colors and rich texture. It's authentically flavorful. It's got a strong regional connection and link to local culture. There's a very famous saying that pay the farmer now or pay farmer later. Very telling statement. Either you pay the farmer now or pay farmer later. Now, these are the healthy drinks that we were children and we told our children to take this. And, we got scolded if we didn't take Horlicks or Complan. We told our children the same. And then we scolded our children if they didn't eat the biscuits that we sent them to school. But these are all like smoking. These are like extremely bad calories. But somehow these companies have managed to sort of brainwash us saying that these are healthy food. These are probably the most harmful food. As you'll find out later, they contain sugar, much more things than sugar, surely worse than smoking. But we forced or compelled our children to take that. We ourselves were compelled by our parents to take this. Are we swallowing sugar-coated science? Yes, for the last 50 years, the companies have made us swallow the sugar-coated science. So when you come to carbs, there are ugly carbs you told about. All these fast food, sodas, your pizzas, all that is ugly carbs that we know. We talked about earlier. Now, when you have white bread, white rice, pasta, maida, etc., they are bad carbs because they are refined. So what should you do? You must make them into good carbs. So we can go into whole wheat bread, brown rice, red rice, white potatoes, as long as natural and nature has given us, it is good calories. So don't think carbs are bad. Don't let anybody tell you carbs are bad. It is just that we're eating bad carbs and ugly carbs. Good carbs are good to take. So refining of rice. So, the rice is a very good thing to eat, but unfortunately we started refining it into white soda, almost white soda. Therefore, we find that its glycemic index is very high. White rice is 90. That would be really toxic. Brown rice is much better. Red rice is only 55. And we have this Kerala red rice. Again, has a very low glycemic index. These are all good things to eat. But instead of eating in Tamil Nadu and South India, we eat this white rice, which is almost a toxin. Because this is, all the good nutrients has been taken off and is nothing but bad carbs that you're eating. No wonder we're getting lifestyle diseases. What about wheat flour? Now, when you talk about maida, they put bleaching powder on wheat to make maida. So all kinds of bleaching powder, just like the other bleaching powder that we use in swimming pools and etc. Same kind of bleaching powder. A lot of residues of the bleaching powder are in all this processing. You have all these. They're nothing but, so maida is toxic. It's got residues of bleaching powder in it. So, and if you combine this maida with processed sugar, like what they do in any biscuit, they would combine maida with sugar, processed sugar, and that amplifies the bad effects of both. So, and as we see, what are the items prepared from maida, right from naan to pastries, cookies, puffs, sandwiches, samosas, everything is maida. And maida is toxic. And then we want to get healthy and we wonder why we are getting unhealthy. This is the reason why we are getting unhealthy. Now we have to substitute this with natural, whole form that nature has given us. Whole wheat flour. There are a lot of other alternatives, made out of now millet dosa, keto flour, etc. These are all good alternatives to maida. What about proteins? Now, anything that is, this nature has given us, fresh vegetarian and non-vegetarian sources, whether it is, eggs, meat of any kind. Let not anyone tell you that red meat is bad or anything like that. Fresh meat, any meat is good sources of nuts, very good source of proteins. Now, bad proteins are that comes in packs and tins or protein powders. So processed meat, stay away from processed meats, protein powder, processed dairy products, protein energy bars, shakes, canned vegetables. All these are toxic. So natural protein is very good. What about fats? Very similar, whether it is paneer, whether it's nuts, fresh animal produce, fish, chicken, ghee, excellent. Homemade or farm-made ghee, nuts, very good. What are bad fats? Again, when something says it's low fat on the label, it is really a bad substance, because once you remove fat from a food, it becomes unpalatable. So they add all sorts of things. Usually cholesterol is added, which is toxic. And therefore they add all the sugar and cholesterol to make it, palatable. So that's the, so anything, stay away from anything that says low fat. Low fat is so injurious to health. Good fat is so good for health. Let not anyone say that fat is bad for you. We'll come to that a little later. But any natural product, whether it's meat, paneer, ghee, very good for you. Good calories. And this one, we'll always think of it as a very good thing because it contains fruits, it's low fat, yogurt is very good. It's a great health product that we all think of. It's the worst health product that you can see. It'll contain 5 to 6 spoons of sugar. It's all artificial. And something like, fruit yogurt is probably the worst food that you can have. So now we have to understand the 3 macros or the 3 macronutrients. So let no one tell you either fats, carbs, or protein is bad. All 3 are good. And that's why we have in nature, and that's why we have in the evolutionary process. So all of them have important roles to play. Only thing, they have to come from good calories. That's the only point that you want to make. The fundamental common sense principles of diet is the following. So as the body needs all 3 macros, it is illogical to say any of the macros is bad for health. Completely illogical. However, proportion is crucial. That's where many make the mistake. You must learn to dial the proportion as indicated. All natural food is good and all processed refined food is bad. Very simple. It's not rocket science. It's very simple. Okay. Let's pause this. Can you see my slides?
Yes, sir.
Yes, sir.
Right. Yes. So that brings out to the an important topic. Why why they have been sort of calling fat a villain all these years. If fats are also so essential and good for health, why have been vilifying it in the past all these years? That's what you need to talk about. You can see my slide?
Yes.
It's not changing, sir. It's still
No,
on
not
understanding the three
so. It
macros.
says past. I don't know why it says past. Resume share, yeah. Okay. Oops. Where are we? Okay. There we go. Okay. So we have to find out why we've been vilifying fats. So the story starts here. It's an important story that you must all understand. Some of you might have heard it, but it's a very, very important story that all of you must be aware of. So 1955, Dwight Eisenhower, we all know Dwight Eisenhower. He was the war hero. He won the World War for the US and the Allied forces. And he used that popularity in the war to become the American president. Can you see the slide now?
Yeah.
Yeah. So the American, so he became the American president in 1952, I think. And then 55, Dwight has a heart attack. And everybody wonders why he's a war hero. He's been in the army. Why would he have a heart attack? Just like our Saurav Ganguly had a heart attack. So people try to find out why he had a heart attack. And so this guy, Ansel Keys, who's not even a doctor, he's actually a marine biologist. He does a study to find out what is the villain behind the heart attack in 1955. So he goes to a lot of countries and then he publishes this infamous study. So he says he takes 6 countries, Japan, Italy, England and Wales, Australia, Canada and the US. And he says those countries which eat a lot of non-vegetarian fat, beef, pork, chicken, etc., has the highest incidence of heart disease. And those who do not eat this, typically Japan, have the lowest incidence of heart disease. And so he says, I have found out the villain for heart disease, and that's fat. And then everybody in the US says, it's a great find, and we have solved the problem of heart disease. So he becomes overnight a hero world over, and cholesterol is blamed as the cause for heart disease, and he is featured on Time, etc. And he becomes truly a hero. However, it was many, many decades later that we found out that actually he had faked this study. So actually he didn't go to 6 countries, he went to 25 countries. And then when you do the plot didn't make any sense at all. So what he did very conveniently, he chose 6 countries that suited his hypothesis that fat was the problem. So he chose only 6 countries out of the 25 countries. And therefore, he got a very convenient plot to propagate his theory. And then he said fat was the problem. So this phenomenon that if you eat fat, cholesterol will go into your coronary arteries and block the coronary arteries. That concept became entrenched the world over. And cardiologists kept repeating it again and again. And we all thought if you eat fat, go and block your coronary arteries directly. So they said, avoid fat. Now, if you avoid fat, you just cannot avoid fat. You have to replace it with something else. So protein is relatively a costly thing to have. So most countries the world over substitute with carbs. Now, countries like India, where the carbs are already very high, we said no fats, and we said we'll take more carbs. And this reached toxic levels of carbs. And this very clearly coincides with the rise in chronic diseases in India and many countries. So processing of natural food to make it low fat. This created an avalanche of lifestyle diseases the world over. So we talked about low fat food, very bad, refining of rice. So people said you must not use natural oil like coconut oil or groundnut oil, and you must use artificial oils which are low in cholesterol, which is very heart healthy, like sunflower oil. And even today, most households in India and Chennai use this sunflower oil. So you can see this advisory that came from the US, and our cardiologists also propagated the same thing. And they said sunflower oil is healthy for heart. Do not use any natural oil and use all these things. That is completely wrong. Nature does not make bad fats. Factories do. Now remember that sunflower oil or corn oil is made in the factory. You cannot cold press sunflower to get oil. You got to treat it chemically. So cold pressed oil that our ancestors were taking in India for many, many years was good oil. They just did cold pressing at villages, and that was a very good oil. Whereas this oil is sunflower oil, again like wheat, it has gone through a lot of chemical processing. It's almost similar to processing of petroleum. The process that it goes through, this oil to make this oil, this this almost colorless, no smell oil. It's almost like refining of petroleum. And that's what most households today use. And no wonder our heart disease is going through the roof. There's no surprise in that at all. And if you see the India, all our use of mustard oil, groundnut oil has come down drastically 1/10, whereas sunflower oil has gone up 10 times in the recent times. So we are speeding in the wrong direction, and there's no surprise that heart disease is just climbing through the roof. Now, artificial trans fat. Artificial trans fat comes from these artificial vegetable oils, sunflower oils, corn oil, etc. These produce this villain, artificial trans fat. This is the biggest dietary villain. Now, reheating cooking oil will cause trans fat. Industrial cooking, high temperature and long duration will cause trans fat. Any food that needs to have a long shelf life will cause artificial trans fat. Now, the cardiologist prescribes this oil because it's supposed to reduce the level of LDL, which is true. Now, we are really questioning the point whether reducing the LDL is a good thing or not. I'll come to that in a while. And processing vegetable oils also decrease HDL. We know that reducing HDL is a bad thing. So by trying to create something artificial, you've unleashed this monster artificial trans fat that's present in our diet so rampant. And this is the main cause of heart disease today. So the vegetable oil, processed oil, is the main cause of trans fat. And that's where we are struggling from. Whereas naturally occurring fat that occurs in meat, etc., is a different form of trans fat. And this is not detrimental to health. All these foods that we buy are very rich in trans fat. All is processed food, fast food. And trans fat will cause heart disease, diabetes, all is lifestyle, breast cancer, vascular disease, and all that. That's the trans fat. Now, it took us more than 5 decades to realize the mistake. Now only we're realizing the mistake. So Ansel Keys was the big hero in 1960. His cholesterol was bad. In 1997, Time said cholesterol is actually not bad, it's actually good. And in 2014, Time came out with a cover saying, eat butter. Fat is good. So till date, the companies have been deceiving us because they want to make food in some factory in the US or somewhere and ship it all over the world. And they said natural food that we have locally is bad for you. The food that cornflakes that we ship from the US is best for you because you have put some vitamins into it. And we buy that. And in all our homes, cornflakes in the morning that has been shipped all the way from the US. And then we don't eat our local food. So how the American health guidelines turned the whole world unhealthy. So you can see that, when the low-fat guidelines came, people were reasonably healthy. But once the low-fat guidelines came, all lifestyle diseases and obesity skyrocketed. And then the American USDA food pyramid gave exactly the wrong. They said, you take all the refined food, take white rice, white bread, all these things. And no wonder all the world over, because we are all, the rest of the world, America, blindly, we all copied that without thinking, and all the lifestyle diseases from 60 to just skyrocketed out of shape. The foie gras, some of you might have had foie gras. Foie gras is a delicacy in France. So how do you make foie gras? You take a duck or a goose, and then you force feed it with carbs, usually corn. It's called as gavage. So you put a tube. A duck cannot eat so much of carbs. So you put a tube and keep on feeding it. How long? Not for years and years, just for 1 month. You feed it, the liver will go to 10 times its size. 10 times its size in 1 month, you go. Then you sacrifice the duck, then you harvest the liver. It's the real delicacy in France. That is foie gras. Now, in South India, we are doing foie gras on humans. So we eat carbs for breakfast, full dose of carbs. Then we eat sambar rice, rasam rice, and curd rice carbs for lunch. Then we eat paratha or dosa for dinner. This is nothing but foie gras on humans. And then we say why we are unhealthy. And no wonder why our incidence of fatty liver disease, non-alcoholic fatty liver disease has skyrocketed. Most of the liver transplant, I believe, are done today is for fatty liver disease. And if any one of us does an ultrasound, we'll have fatty liver changes. I'm sure you all seen that. And we say it's age-related changes. It's not age-related changes. It's diet-related changes. It's not age-related changes at all. This is human foie gras that we're doing in South India. So healthy carbs is a very important part of our diet. No question about that. But you cannot have the whole diet. Has to have some. Come to the question, non-alcoholic fatty liver disease so high. How do we dial the macros? We call dial the macros. So very simple, no calorie counting, nothing. So you take a plate, only 40% can be carbs, good carbs. Rest 60 must be non-carbs, because protein and fats you cannot differentiate much. So very simple, 40% has to be carbs or less, 60% has to be non-carbs. Very simple. And then you get your proportion right. That's how we do it. So how do we actually do it? How do we advocate people do it? You got a small plate technique. Where if you take a small plate, you can find the proportion correctly. But if a large plate, it's difficult to work out the proportion. So eat small plate by small plate. Always eat till you're full, till you reach satiety. Very important. You can have second helping. You can also have third helping if you want. Eating is never been the problem. When you have finished the entire first plate fully, not one constituent, not the carbs alone, but use the entire plate, you can have a next full helping. But the proportion must remain the same. And you must be confident of finishing the whole thing before you opt for a second helping, third helping, fourth helping. That's fine. Don't stop. But the proportion must be maintained. So we now believe that calorie counting is bad. Dialing is by volume, no calorie count. So once you progress on your diet, you'll be able to dial your macros for different things. I'm not going to do a little more advanced thing. But basically remember that that's not the only criterion. That once you become better at dialing your macros, you need to give some preference for other factors as well. I will skip this for the moment. The other important thing of the diet is to have a rainbow diet for micronutrients. We talked about macros, now micronutrients. So how do you get micronutrients? Not by eating multivitamin tablets. It's by you must eat a rainbow diet. So your diet must include colors. All possible colors, fruits and veggies. So macros, and that's how do you fruits and veggies of all colors. You have done your rainbow diet. So your macros are set, your micros are set now. Then we move on to the gut microbiome. So this, we can, the bacteria living in our gut is very important, and we can damage it by main things. And what are things that influence it? Main things is diet, drugs, antibiotics, activity, very important. So if you have a deranged gut mind, again you have the same diseases, exactly the same disease, liver disease. You lower immunity. Everything is the same thing in different forms. Obesity, metabolic syndrome, inflammatory bowels, cancer, all the same thing again and again. So we don't want to do that. So how do you damage your diet? By eating all this wrong food, you damage the diet. So now, how to look after your gut. Now we have a concept of food. We talked about the bad food, refined sugars, processed food, fast food, packaged food, refined oils. We got prebiotic and probiotic foods. That's very important. Prebiotic foods are the veggies, fruits, legumes, grains, where you want a substrate for your good bacteria to grow. The probiotic foods contain the good bacteria. Yogurt is very good. Kimchi, raw cheese, etc. have the bacteria in them, and that's the best probiotic food. Remember that exercise is very important for your gut microbiome. Again, in the template, all these things are important. It's all only one story. Each for liver is not a different story. For heart is not a different story. Nothing a different story. It's all the same story. So if we don't, follow these principles, we all have a abdominal obesity. Now, what is the significance of abdominal obesity? Is that if you have fat in the body, it's not dangerous. Now, amount of, the abdominal that you have in your belly, exact of what you have, I'm sure Patta would testify to that. Whatever is outside, exact mirror image of that inside. And this is what we call as visceral fat. So the belly fat outside mirrors the visceral fat inside. Both together constitutes the abdominal obesity. And abdominal obesity, it drives the inflammation, the seat of inflammation in the body. Once you have all this fat, you eat the wrong foods, all this fat gets inflamed, and this drives these pro-inflammatory substances, and we get sick, we get joint pains, we get heart disease, we get liver disease. It is the fat is the site of inflammation in the body. So your waist circumference is very important, and you must work towards reducing that. So this abdominal fat is like having a battery in your belly, and as long as you have the battery in this belly, you're not going to get healthy. So whatever you eat, this battery keeps driving it, magnifying it, producing inflammation all over the body. Again, the same things: trans fat, omega-6 fatty acid, which is present in artificial oils, your fructose. So all this. So 6 signs that you have inflammation, you have person pain, fatigue, frequent illness, immunity comes down, the body is on fire, giving you all these symptoms. Again, the same again and again. So 21st century, the population worldwide is sinking into chronic sickness about obesity, low-grade inflammation, gut microbiome, and all these produce the same diseases, lifestyle disease again and again. So how do we respond? As doctors, we think we have a fix. We got a pill for every problem. The message I want to give you today is that, take-home message, lifestyle disease cannot be cured by drugs. One has to address the source. That's the fundamental. So we are specialized into many subspecialties now, and no one is seeing the bigger picture. No one is addressing the elephant in the room. Everyone, the cardiologist looks at and gives some statins. The gastroenterologist prescribes medicine. Diabetologist gives some anti-diabetic drugs. We do knee replacement on the patient. Psychiatrist gives some antipsychotic medicines, but it's the same metabolic derangement that is being manifested in different organs that we are seeing in all departments. The basic tenet of nature is that, our body has been fine-tuned by millions of years of evolutionary engineering to digest, process, and use the natural available food that has been present to us. So we have been made for the food available. Now suddenly the last 50 years, American Heart Association and somebody told you this food is good, so you take them manufactured in the US, and our bodies are not made for this food. Our bodies are just not made, evolutionarily made for this artificial food, and therefore the body is on fire. Our body rejects and becomes inflamed and chronically sick for artificial man-made food of any kind is consumed. So you want to go back to natural food. So this is the summary, which I will skip, which I already told you about. Now, how are we on time, Pata?
No problem, sir. You can carry on.
Carry on.
I will at least finish the fasting part of it, and then we can move on. Yeah. So the recent change in our pattern of eating seems to be ruining us. Now remember that millions of years we hunted down animals, ate some raw fruits and vegetables, and our body was made for that. So food was not available all the time. So we ate when we had food. We didn't eat when we didn't have food. And that's how our body has been made for that. Then suddenly the US guys come and tell us that you must have 3 square meals every day. And nobody knows where this came from, actually. Yeah, very interesting to know. But somehow we all think our parents told us this. We told our children that you must have 3 meals, otherwise it's not good. And then the easy breakfast was available. So even today, breakfast, nobody bothers to cook anything. They have some cornflakes, some bread, easily made things, mix it with milk and take it. Nobody knows. So for the 50 years, last few decades, we went to 3 square meals. But recently, they have been non-stop feeding. We sit before the TV and we have so many snacks available, and we keep on eating and eating and eating. Now you will say, why not evolutionally we change to this? Evolution takes millions of years. Evolution cannot be year on year. That doesn't how evolution works. Genetic adaptation has no chance with this pace of change. It just doesn't. Remember that our hardware has been made for software, which is naturally occurring animal food and vegetable food. It is not made for all these things. So the ancient man had access to food only intermittently. And our bodies are built by evolutionary engineering. That is the fundamental concept that we have to understand. So when we eat food, we signal the body that food is now available, just like the ancient man. And therefore, we must store reserves. For times it's unavailable. The body goes into energy conserving mode. So when we eat food, it tells the body, I have food, I must store. It stores food. So how do we store food? Liver and muscle can store a bit of carbs. It's often compared to a wallet or a purse. Little bit is available. However, the body amount in a fat. And that's why we can go fatter and fatter and fatter. Unlimited. This is compared to a fat bank. The bank there, which you can go on store. Now remember, this is our energy source, or is meant to be our energy source. But we tend to misuse it. Now we stop eating, we signal the body that now food is not available, and therefore we must tap into the fat and use that fat for energy. That's how man survived for millions of years. He ate food when it's available. When he didn't have food, the fat in his body gave him the food to eat. Okay, and therefore the food is much more than what we think it is. It's a complex entity conveying many signals to the body. Okay, so if we constantly keep eating, the signals tells the body that I'm trying to conserve energy, conserve energy, conserve energy. So the question to ask is that, do all people who are obese necessarily overeat? I do not eat much. Why am I fat? It's a common question that patients come and ask us. The answer is no. All obese people do not necessarily overeat. But what mistake they do? There's a frequent eating without an interval. That is a problem, and not the total amount of eating. Many people have this problem. And I have actually intervened many patients, and they have actually lost a lot of weight. They become much healthier, although they eat the same amount of food. Now, why is it so? As I told you earlier, the body recognizes only two states of, either it's a fed state or a fasting state. You cannot be on both states at a given time. So if we take food, you signal the body, I'm on a conserving mode. I may not have food later. So store, store, store. And when you don't have food, you're fasting, you tell the body no food is available, start using your own body fat. But when you keep on snacking, eating constantly, the body is always in a fed state. You do not give a chance for the fat to be used. So by keeping the body constantly in the fed state, the body does not get a chance to go into the calorie burning mode at all, resulting in obesity. So the total calorie consumption is not in excess. Many patients will tell you that, I'm not eating much, doctor. The problem is they are eating frequently, and that's the problem. Now, convenience like this was not available 5 decades ago. There's a microwave, Swiggy or Zomato and refrigerators has made snacking very easy. Earlier on, when you had food, you had to prepare the food. It took time. There was interval between meals. But now, nothing at all. Just Swiggy something and eat instantly. So the perils of constant feeding and snacking is unbelievable. Yeah. So when we eat, the insulin in blood rises to various levels depending on the type of food that we know. So we keep on snack, the insulin level is constantly high. That's the problem. We never give an interval for eating. Therefore, the body will develop resistance whenever anything is in excess. We know that. When you give too much antibiotics, we get antibiotic resistance. So like that, we get insulin resistance. So we develop constant high levels of insulin cause insulin resistance. Now, what's the problem with insulin resistance is that we told about the fat bank that we have. Once you develop insulin resistance, you can only deposit in the bank. You cannot have withdrawal. Your checkbook has been taken off. Your ATM card has been taken off with insulin resistance. You cannot withdraw from this bank. You only keep depositing. So you're in a trap. You only keep depositing because of insulin resistance. You cannot take away anything. So symptoms of insulin resistance, that is, I think a lot of people in India have insulin resistance. So there's a lot of fatigue, frequent use of the toilets, cravings for sugary things, tiredness, and skin dermatitis. All these are symptoms of insulin resistance that we must. So why should we all be aware of insulin resistance? Because every third person has insulin resistance in India. So when you're hungry, eat excess carbs and processed sugars and all that we eat. So pancreas produces more and more insulin, but there's insulin resistance because of constant feeding. So cells ignore insulin because of the resistance. So pancreas makes more insulin, which makes you more hungry. Insulin make you more hungry and eat more. So this is a vicious cycle that leads to the burnout of the pancreas. That's what causes the pancreas burnout. So pancreas must produce more and more insulin for same effect due to insulin resistance, and finally it burns out. So why everyone, not only doctors, must know about insulin resistance is because in this stage, when you still haven't lost your entire pancreas or your insulin producing cells of the pancreas, diabetes can be reversed. A lot of things saying diabetes can be reversed, cannot be reversed. The thing is, if still your pancreas has got cells, you find out insulin resistance through good lifestyle intervention, you can reverse diabetes, and we have done it in so many patients now. But the pancreas must still be active. So you must pick them up in the insulin resistance stage or the pre-diabetes stage or the early diabetes stage. Okay, once the pancreas burns out, then obviously you cannot reverse diabetes. When the whole pancreas or most of the pancreas burns out, then you get type 2 diabetes. Okay. Now we come to the important concept of fasting. Fasting has got many benefits. You'll have reduced cancer, better health, better brain function, better sleep, etc. Now people think that intermittent fasting is a new fad. It's not. The term IF, etc. may be new, but fasting itself is centuries old. Now remember, there's no religion in the world, without exception, no religion in the world that does not have fasting as an integral component of the religion. No religion. And in places like Singapore, where there are multi religions are there, the common platform they do to combine or bring all religions together is by fasting. So you can bring all religions together because the common thread in all religions is fasting. Now, what is the difference between a negative calorie diet that we've been advocating the last 50 years and fasting? Now, we said eat less, cut your calories. If we do that, what happens is you lose weight. Then you find your body goes into conservation mode. So then what you have to take more to regain the same weight is less. Then you feel blame and guilt. So eat less calories. It's a vicious cycle. It's not worked for the 50 years. So you have constant hunger and craving for food. You're miserable when you're on a negative calorie diet. I told you that in the modern way that we look at things is that you must eat till you're full. Eat good calories. Interval between meals, but eat till you're full. That's very fundamental of good health. So many people call fasting as the miracle of fasting. Why? Because when you fast, I'm sure Selvi and all those here who have had experience in fasting, you have a sense of well-being. You're not miserable. You feel energetic because your fat sources are being tapped into. The basic metabolic rate is actually high, not low, like in starvation. The BMR is actually high in fasting. So fasting is fundamentally different from negative calorie diet. So what are the principles of fasting as a part of a healthy lifestyle? Now remember that like ancient man, you must have a gap of at least 12 hours of not eating anything. That's fundamental for everyone. The only exception being advanced diabetics who are on many medications, insulin, etc. Doesn't hold good. The rest of the people, you have to fast, not minimum of 12 hours for everyone. Now remember that there are a lot of other things going on in the body apart from digestive hormones. You must give digestive system a rest that other things can function in your body. Now, for some people, you have to extend the fast to 14 to 16 hours. Now, who should not extend fasting? Those who have low BMI, who do a lot of exercise, cannot eat much at one time. They must not extend the fast beyond 12 hours. Other people can extend. So who should extend? Your BMI is high. You have all these lifestyle diseases. Then you must try and extend your fast beyond 12 hours to 14 hours, 16 hours, rarely to 8. So you must learn to dial your fast. So what can you drink while fasting? It's important to be hydrated while fasting. Absolutely important. So we can drink what are known as zero-calorie fluids. So the principle is that if any fluid contains less than 10 calories, it does not give the signal to the body that I start eating. If you start eating, then the body goes into shutdown mode. So you can drink it, any zero-calorie fluid. So what are zero-calorie fluids? Most important is water. Black tea without sweetener. Any kind of tea, green tea, fine. Clear fruit infusion, not fruit juice, fruit infusions. Half lime, even a full lime may contain more than 10 calories. So half lime. Very transparent, watery soup. These are all our zero-calorie fluids. This will not signal your body and you can take them during your fasting. It's important to be hydrated while you're fasting. Another concept is what is fat adaptation and why is it critical for it to be fat adapted? So historically, for millions of years, as I told you, man had food when it's available, and he used fat in his body for his energy resource when fat was not available. Fat adaptation means we reclaim our intrinsic ability to burn fat for fuel. We have been using fat for fuel for millions of years, but suddenly over the last 50 years, we cannot use that fuel. We keep on accumulating that fat in the body because we're giving carbs and processed carbs constantly to the body. We cannot use the fat for fuel. Fat adaptation means reclaiming your intrinsic ability to use that fat. So fat adaptation is primarily achieved by fasting on a fixed period on most days. So once in a way you don't fast, okay, but you must have a fixed 12-hour fast, 14-hour fast for most days of the week. Exercise and good sleep also helps in one becoming fat adapted. Now remember that if it's like a laptop. If you keep your laptop constantly on the power mode, then sooner or later your battery circuit will go away. Suddenly you want to work on battery, it's not available because you've been on power all the time. The battery circuit is gone. So similarly, if you don't use the fat in your body, then when you want to use fat, it cannot. So you must teach the body to use the fat that is stored, and that is fundamental. So we call this person like this a sugar burner. Who's a sugar burner? Only limited sugar can be stored. The person must eat frequently because they're only using sugar. So they're constantly tired. They must keep on eating because they can use only sugar. They cannot use fat. So stored fat keeps on storing and storing, not being used. And usually you develop lifestyle disorders. Whereas this person on the right, we call them a fat adapter. Why? They're always energetic because they don't have to eat food to be energetic. Food is always stored. There's a battery of available in your body, use fat. They're able to intense activity. They never get tired because they have this huge fat battery they can tap into for any time. Does not feel hungry frequently because you have fat again. So body fat is used away and you're much more slim and your contour is great because your body fat is being used up and can go without food for long periods of time. Now, is there any other benefit of fasting? Of course there is. So many people, just casually say that if you have daily fast, will prevent cancer, your skin will become nice. Those are not true. So if you want that effects, for example, in cancer prevention, you need to go into what's known as an autophagy fast. What is autophagy? Autophagy when the body eats and recycles its own damaged cells and toxins. That's what we call as autophagy. So prolonged fasting periods integral to many religions. We know many religions, whether it is Ramzan fasting. I think now we have Ramzan fasting, Christian fasting, Hindus, all prolonged periods. These are the science behind that is autophagy. So it's now accepted that you need to fast for a minimum of 24 hours to induce autophagy in your body. So this should not be done frequently, once a month. That's what, or once in a way. If you do that, then you induce autophagy. All your damaged cells in the body gets rid. So this is true science. There have been 2 Nobel Prizes for the science of autophagy. When autophagy was first discovered in 1963 and very recently in 2016, the Japanese Yoshinari Oshami got the Nobel Prize for his work on autophagy. This is pure science, autophagy. So the autophagy is the most potent tool that we have for cancer prevention. Cancer prevention, by eating some antioxidant, you are not preventing any cancer. Just like how you are not improving immunity by eating vitamin C. Please don't fall into those traps. How do you build immunity? Same thing again. How do you prevent heart disease? Same thing again. How do you prevent fatty liver disease? Same thing. There's nothing specific for everything. It's a common mechanism for all lifestyle diseases. So the most potent tool that we have today for cancer prevention is autophagy fast, where you get rid of your damage. After all, the damaged cells in your body is the seed for cancer, that we know. So how to get rid of them? You do autophagy fasts. A lot of other benefits. You charge up your mitochondria, you prevent neurodegenerative diseases, your cells become really, your mitochondria is really energized, etc. But the most important thing of an autophagy fast is prevention of cancer. Now, this is a slide. I hope there are some cardiologists in this listening to what I'm saying. A very, very important point I want to say is that when you do all the lifestyle changes that I've told you, you do fasting, you eat good calories, you're doing scientific exercise program, your LDL goes up. And that is shocking. So I've been involved in this very actively for the last 3 years or so. And anybody who follows this, the LDL goes up. And cardiologists don't like LDL going up. So there's something really wrong here. So remember that exercise has got no effect on LDL. Natural sources, all that I told you about, raises the LDL. Intermittent fasting raises LDL. So the only thing that can reduce LDL is statins and a fat depleted diet, which I told you is so harmful. Low fat food is harmful. That is the only thing that will reduce LDL. So looking at LDL and saying that your risk for heart disease is doesn't make sense. Complete doesn't make sense at all. So what we look at now is the atherogenic lipid triad. We want to look at HDL. Doing all these lifestyle changes, you'll increase your HDL. You'll increase your triglyceride. Very, very important. And we look at ApoB, a subfraction of LDL, which is really the culprit. LDL itself is not the culprit. It is the subfraction of LDL, the ApoB, which is the culprit. There are a lot of studies now that LDL cholesterol is not the problem, but the subtype. So don't go by LDL values. If you do all these changes, all the lifestyle changes, positive lifestyle, your LDL will go up. And that's a good thing. So now we believe LDL levels up to 160 is normal and healthy. We want you to have high LDL. It's a very important point, but cardiologists will hold the other view, but now they're also changing. Now, one point about hydration, never forget hydration. Because we are in an air-conditioned environment most of the time, we forget hydration. So basically the rule is you must hydrate 4 times a day, tall glass 4 times a day when you're not thirsty. Because our body has mechanisms to drink when you are thirsty, but because of all the artificial temperature that we have, those mechanisms have been totally blunted. So you must drink 4 tall glasses of water when you are not. And drinking teas and infused water is very good for health. And we recommend that very strong. I think we will stop here before I go to exercise. I think we'll go on to questions and things. Patta?
Yeah, sure. Vijay,
Maybe do some other day.
Vijay, take over, please.
So I saw 2 questions on the chat box. What about herbal nutrition?
Sorry, what is that?
Somebody had asked, what about Herbalife?
I did mention that previously.
Yeah.
So these are all meal replacement things. Most toxic thing that you can do. So you'll go into an acute weight loss phase, and then you'll get fat overshooting, and then you'll get hungry. You'll get very, tired. You'll crave for food. Then you'll start eating, gulping, and then you'll do overshooting of fat, and that's very, very bad. Keep away from these meal replacement powders. Absolutely, I told you, meal replacement powders are bad news for health. Bad news for health.
And then there was one more question: is full fat milk okay to have? What about milk?
Yes. So the dairy is a very important question. Now, dairy, people always say this thing. So 2 things, we have these food allergies. Allergy that we know, suppose you are allergic to shellfish, for example, we know that you will get histamine release, get flushing, you can't breathe. That's very obvious. So we don't discuss that. But we'll have very subtle food intolerances we have. That's important to identify. Now, what has now come to light is that that food intolerance are more common than we think. So once in a way, if you take intolerant food, nothing. Now remember that anything that can be done occasionally, nothing will happen. But 2 things that is very likely that you're going to have on an everyday diet. One is lactose. Every day we're going to drink milk. And the second one is gluten, wheat, everyday diet. So if you have intolerance to both, it's not good for you. But for the rest of the people, full fat milk is full natural product, butter, cheese, very good. Please have them. This is all nature has given us. Very good food for us. Please take them. Apart from those who are intolerant. Lactose intolerance is roughly about 30% of the population. Gluten intolerance about 10% of the population. So those people must not take it.
Another question about, explain a bit more about autophagy diet.
We have the exponent of autophagy is Selvi herself. Selvi, you should explain that, Selvi.
So there's this prolonged fast actually is really good, like what Vijay said. If you look at even I'm more familiar with the Hindu way of fasting. Every 15 days, we have these tithis. So Ekadashi is the most popular fasting for Vaishnavites and Shaivites also. The Shaivites do Pradosham fasting. If you look at it, people fast more than 24 hours. And earlier days, the fasting was completely no food, and then we corrupted it to add the fruits, milk, no grains, whatever. But if you look at the traditional way that fasting was prescribed, we stop eating with 1 meal the previous day. That is on the 10th day of the lunar calendar. On Dashmi day, on Ekadashi, 24 hours you fast, and then you eat on the 11th, so that is how the 12th day. So that is how it was done. So that makes it more than 36 to 40 hours of fasting. And that was done every 15 days consistently. And so people were healthy. And if you look at traditional households, conservative Hindu households, there were only 2 meals. So most people finished all their work, they did their puja, went to the temple, ate at 11 o'clock. And then they ate again before 6 o'clock. So, and if you look at Jains, even today, they don't eat after sunset. And then, the interval between, there is a very interesting study done for breast cancer recurrence. And this study, Spanish study, found that the interval between dinner time and bedtime, so if it is at least more than 2 to 2.5 hours, those patients recurred less. So fasting actually had a big role to play, this intermittent fasting. And now to the extent that I've started recommending intermittent fasting and possibly autophagy to patients, just like you have different arms of treatment, like chemotherapy, radiotherapy, hormone therapy, trastuzumab, targeted therapy. Now I've started including one more arm, So intermittent fasting is now as important as any arm of treatment, at least in the way I put it across to patients.
Absolutely, that's the way to go. I think all of us should incorporate that into our therapeutics, I think, yeah.
So can I ask questions to the August audience? So all of you are physicians, and most of you, as you rightly said, we go to a cardiologist, we go to a diabetologist or endocrinologist. They give the patients a whole lot of medications. Now you recommend them to go on intermittent fasting or autophagy. When you give them so much of medications and you ask them to be on fasting, how does that work, sir? And so Patta sir also will tell, because that definitely induces gastritis. And whenever you go to a diabetologist, when you take a patient there, they say, yeah, this patient is diabetic and definitely he's been diabetic for 10 years. You start on statins. And when they come to us, we advise that, a chronic usage of statin again causes COQA, reduction, and that again loses the elasticity of the coronary artery. So everything, but when we tell them, they say no, diabetic for 10 years, he has to be put on statins. So all these are things which, is something different from but your talk, sir, was excellent, very good. And, it is the truth. But the thing is, when people are on such huge medications, how do we advise them, sir, to be on intermittent fasting or autophagy?
Yeah, so let me answer that. So the first thing is about a lot of people say that, they already have peptic ulcer disease, they have hyperacidity, and then if it's fast, then you're going to aggravate that. Now, Selvi also knows a lot of people in my batch who had it and then now they don't have it. And I know at least 25 people who had peptic ulcer disease, but they don't have it anymore through fasting.
Yeah.
But the important point is you must eat good calories. You eat fast food, junk food, processed sugar, and then you fast, you're sure to develop peptic ulcer. Yeah. But if you eat good food, you fast, your ulcer will go away. Trust me, I have so many examples of that. Your thing will go away. Your acid peptic disease will go away. So people have been on ranitidine and H2 receptor antagonists for years, and we now know it's toxic drugs. They've been on years and years and years. And if you eat good calories, same principles. It's not different for cardiology, not different for GI, not different. That's the beauty of the whole thing. It goes away, absolutely goes away. Now, statins, I have a full talk on statins. So I'm not able to tell you the entire thing on statins. But as I told you in short, this focusing on LDL and giving statins to everybody is completely wrong news. So today, if you all start following this and you do your LDL today, you do it 3 months later, your LDL will go up by all these positive changes. That means that this LDL business is complete sham science, okay, and being promoted by the statin. How much is worth a year? $20 billion. They can buy all of us outright. They can buy India outright. $20 billion. So no wonder everything gets influenced. So now cardiologists use patients who have familial hypercholesterolemia. They are a different bunch. They need statins, no question about that. And diabetologists use type 1 diabetes. They need insulin. Don't mix these both. Type 1, they need intervention, no question about that. But those are lifestyle diseases. Type 2 diabetes, most of the coronary artery disease are lifestyle diseases. This can be managed by these health interventions. Absolutely can be mentioned. You can be very sure of that. Yeah. So statins for rare cases, familial hypercholesterolemia, etc. But no cardiologist tells you what to eat and what not to eat. They tell you must take statins. I mean, what logic is that?
Yeah, Vijay, if I may add to what Vinita is commenting, that I understand intermittent fasting will reduce the requirement of anti-diabetic and antihypertensive medication. In due course of time, you may not need to take as much as was prescribed earlier.
So,
Exactly, I actually wanted to say that.
Comment on that particular thing. Would you go on, just unmute yourself? You wanted to speak on type 2 diabetes and intermittent fasting.
Right. So yes, I was coming to say something exactly like what RK was talking about, which is essentially, eventually, patients with type 2 diabetes may be able to go off insulin or all other medications. But at the start, there are certain things that need to be followed in terms of safety. So one of the things would be to make sure that blood glucose levels are monitored very closely. Ideally, some sort of CGM would be useful, especially for people on insulin. There are plenty of patients with type 2 diabetes who are on insulin. So when they start an intermittent fasting diet, they need to be very careful. Yes, eventually as they lose weight, as their body composition improves, and they start losing visceral fat, you will see a reduction in their insulin requirements. But until that happens, it has to be very carefully monitored. The one thing that I am not very sure about, because I haven't seen much by way of data, is the use of SGLT2 inhibitors and intermittent fasting. SGLT2 inhibitors already increase ketone production. So the question is, with intermittent fasting, will you need less less duration to switch into the ketotic phase of the fast? Is not very clear. Again, done under supervision with proper monitoring would be the way to go. And actually, there are more and more patients with heart disease that are being started on SGLT2 inhibitors. So again, something to keep in mind when that group is treated as well. But essentially, it does look like intermittent fasting has a lot of advantages to offer, and it's really not something to disregard. I totally agree with everyone who's spoken so far that dietary advice for lifestyle diseases is really lacking, and intermittent fasting is an easy way of dealing with it. In fact, it might be more forgiving of, you can even eat processed food, if you will, if you do the fasting better. Ideally, obviously, it's what Dr. Vijay recommended in terms of good food and intermittent fasting. But intermittent fasting, I think, is forgiving even of other things. So.
Vijay, there's a question on the Facebook group by Drishti Batra. She wants to know what kind of infused drinks are good, and at what time should they be taken preferentially? Infused drinks.
So we now have these infusion jars available. You can buy it on Amazon. So where you put whatever you want in the middle. You can usually we use veggies, but if you want to use some fruits also, it's okay. So it's not so it's very low calorie. So it's colorless, but you get a small taste of it. Yeah. So it's we think that some micronutrients come through, no calories. So it's a good. I mean, instead of just drinking water, it's good. And the second thing that is that for example, if you have this okra or lady's finger, it's very good for diabetes. Now it may or may not be good, but it may have a placebo effect. But whatever it is, why not? It's very good for. I mean, it's not bad for health. It works as a 2-ingredient grade. It works as a placebo, so be it. So we recommend all that natural ingredients that we use for various ailments, infusions or as teas. So it may work as a placebo, so be it.
Yeah, Selvi, want to take over some of the more questions on the chat box?
Yeah. So, would you suggest keto diet become a fad?
Yeah, I talk. Keto diet is a fad diet. I mean, just going totally off carbs would be a bad idea. Yeah. It's not a natural thing to do. Keto diet is very good for weight loss, etc. And I skipped over the slide on dialing. So if you want to go through an intense weight loss phase under supervision, then you can increase your reduce your carbs drastically for a short phase. You kick in your weight loss, but then you must add your carbs back again. Now there are some organs in the body that can survive only on carbs. Some of the brain portions can survive only on carbs. Some of the renal medulla can survive only on carbs. So if somebody says carbs is totally toxic, that's completely wrong. You've just been overeating the carbs. It's the problem. But good carbs is very good. But if you want an intensive weight loss phase, you must go really low. So that's what you call dialing your macros. So for different things, you want to put on muscle, for example, you got to dial your macro. All this is available online. It's not rocket science, but it's the basis of it.
So there's another question about soya chunks. What about soya chunks?
Well, as long as it's natural, yes. But processed. Now, processed food, I have to say, is it's not good. So it comes in packets. You buy it and all that. Otherwise, same principles apply. It's not rocket science. Yeah.
Vijay, a word on whey protein and see, these are sold in big bottles, very, very fashionable bottles.
Actually, I have a slide on that. Actually, they are very bad for health. And recently, this has been come through. Now people are promoting it like thing. They're very bad for health. And then this resource powder that we use in our hospitals as a protein. Yeah. So they can be used in a short phase of illness. Somebody is having a surgery in a catabolic phase. They need a lot of protein in a small amount, loaded with the proteins. They're good. The therapeutic value. So we use it in patients, who are very elderly patients, osteoporotic, for a short phase of time. But if you take it as a lifestyle every day, that is very seriously bad for your health. Very seriously bad for health. Absolutely bad for health. And all these bodybuilders and all that, our nephrologist in our hospital, I believe that he has seen a lot of people who have completely gone into renal problems with this.
Yeah. Vijay, one more question. Can food reverse or slow down aging?
Yes, certainly. It can slow down certainly, if not reverse. I think if at all something can have a small effect on reversal, is autophagy, I think. But certainly good food and all this, this template of lifestyle changes that we say, certainly slows down aging. There's no question about that. Certainly slow down aging. Absolutely, yes. Certainly slow down aging, yeah.
The question on stevia sugar substitute.
Yeah,
Made from stevia leaves.
An artificial substitute for sugar. So substituting one process with another processed substance, not good. So go for natural, as I told in my talk, natural thing like karupatti, vellam, panakarkanda, all that is good. Honey, raw honey, fresh honey, maple syrup is a good sugar substitute. And don't substitute an artificial one with another one that's even more artificial. Yeah.
Somebody wants to know, can they have fried peanuts as snack?
Regular evening snack.
The bit of whiskey, yeah. Yeah, I mean, I did mention in maybe I left the slide out. Remember that all fried food, no matter how good your cooking oil is, no matter how good you are at cooking, keeping the temperatures low, changing the oil every time, all the precautions that you take, it's all fine. But there's no fried food without artificial trans fat. However, we don't want to live like a hermit. Please don't get a message that you need to, we're not addressing it at all. There are obviously bad things like smoking, for example. So things are so bad for you. But avoid those things. And other things you can have occasionally. I always tell even, all my friends and things, even if you smoke occasionally, there's no bad things at all. Trust me on that. Absolutely no. If you drink occasionally, no bad effects. Anything that you do occasionally has got no bad things. So you can take sugar, you can take sweets, you can take ice cream occasionally. When it's a problem, when it becomes a part of your daily day-to-day. You have ice cream in the fridge, every day night after dinner, 10 o'clock you go and have ice cream. That becomes a lifestyle issue. Once in a way you go and have ice cream, great thing. Please do that. Please do that. Don't live like a hermit. Don't want to do that at all.
One question they've asked, if diabetic can have karupatti and honey.
Sorry, couldn't get that. Can you repeat that, please?
One person has asked if a diabetic can have karupatti and honey.
Selvi, you got that? I couldn't hear that.
No.
Vijay.
Diabetics have karupatti and honey.
In small measure, yes, I would think. You know, they have sugar. Most of them do have a little bit of sugar as well. So, I mean, I have not taken sugar or karupatti for many, many years now. It's just like smoking. The comparison is so unreal. Why, if you ask people why you smoke, there's no good answer to it. Just no good answer to it. If you ask somebody why you're taking sugar, there's no good answer to it. It's just because I always taken sugar. There's no other reason. I haven't taken sugar for or substitute for ages. Nothing ever happens. And today I cannot tolerate sugar. Frankly, if I go to a house, they give me a coffee with sugar, I have to politely decline and say, I don't want to offend you, but there's no way I'm going to have this. I cannot have it.
Sharon Rajkumar, what do you want to ask?
Yeah, Vijay, Sharon here. Hi. So I asked that question about karupatti and honey because you mentioned it. So in that case, isn't stevia a better substitute than karupatti and vellam and all of that?
Stevia, yes, natural leaf if we use, it's probably okay. Again, if it comes in the powder form, you know, then you have to say that it is, you know, it is refined, it is done. That's where the problem comes in. But if you're going to use it as a leaf and thing, I suppose it's okay. General principle is what, you know, natural food is good, artificial food is bad. We are not made for that.
Thank you.
Vidya, don't you think we should have a full session on exercise by Vijay?
No, why not?
I think he would do it in 2 or 3 more sessions. There's a lot more that he has to give.
No. No, there is we can do that. We can do the other bits all together in one session. That would be all right. Whenever I think we can do that exercise, because you know I can rush over exercise, but that wouldn't do any good. We really need to delve into it. The scientific exercise program is very, very important. That is the third most important constituent. So one doesn't work without the other. You cannot just to give you a fact. You know, your diet will work on body fat, but a belly fat exercise is much more has an effect on belly fat than your diet and fasting. So you know the primary, all three are so crucial. So now people, you know, they just and then you know the doctors give advice saying any exercise is good exercise. You climb steps during in a hospital, that's good exercise. That's not good exercise, I'm afraid. It's like saying you take a red tablet, it'll be fine. I mean, it's as ambiguous as that. That's not true. It's a science by itself. You cannot tell a patient do some exercise. I mean, that's not correct.
Since everybody is on the thing now, you can right away confirm for me either 13th or 20th May. So it works for you.
I'll message you, please. Yeah, right. I'll have to look at my diary. I don't have a diary here.
Right.
Can I ask a question, Vidya?
Sure.
Intermittent fasting and the microbiome. What is what is known? Certainly, all kinds of artificial sweeteners and everything else have been linked with what can I say, the wrong microbiome, if you will, and so are to be avoided as much as possible from that point of view. But how does intermittent fasting affect the microbiome?
I don't have any data or view on that, but I guess that's how man lived. Although we call intermittent fasting now, that's how man lived for millions of years. So I guess that that would do good to the microbiome. And eating probiotics and prebiotics are important, but intermittent fasting as such on microbiome, I have no knowledge on that, I'm afraid. But the general, the template that we have, you do that. Everything is the most important. Again, I'm saying it's the same for everything. You don't have to do anything different. Yeah. So it's for the gut microbiome, whether it is for your inflammatory bowel disease, whether it is for your obesity, for your osteoarthritis, for your neurodegeneration, it is the same. It is again and again the same. And that's the beauty of the whole thing.
If no one else has any questions,
I have one more last question.
Go ahead.
Vinita, you should be giving advice rather than asking questions.
No, sir. No, no, actually, his speech is so good that I feel I'm becoming a common person now, sir.
Yeah.
Right.
Go ahead,
These
Vinita.
are common questions which the patients come and ask us. That's the reason I'm asking sir also the same question. So that's it, like
Can you hold the mic near your mouth? I mean that
yeah.
yeah.
Can you hear me, ma'am?
Yeah.
Yeah. So they asked us, like, ma'am was talking about Egadesi and things like that. So when we counsel the diabetic patients, they tell us that, ma'am, can we, stop medications, diabetic medications or any other medications during Egadesi fasting or, Pradosham fasting or whatsoever? Can we advise it, or is it advisable, or we say no, sir?
Well, you should not just stop medicines. You know, diabetics is the one that's an exception to many of these rules. Yeah, so you got to be careful, especially those who are on many anti-diabetic drugs. They have to be very careful, and then you got to do it face down. You're under a supervision of a diabetologist once all these fasting kicks in. And I know so many people who have gone off diabetic medicines, but it has to be done in a phased manner. But the one important point that I want to make regarding that is, we all think that if we don't eat, we'll go into hypoglycemia. Or diabetics, if they don't eat, they'll go into hypoglycemia. Now, I'd like to say diabetics will not go into hypoglycemia. Only diabetics who are on anti-glycemic agents or taking hypoglycemics will go into hypoglycemia. Otherwise, you won't go into. Naturally, you won't go into hypoglycemia. That's the wrong concept many people have. Diabetics will not just go into hypoglycemia. Wrong concept, yeah. When you are on taking medicines, oral anti-hypoglycemic agents, then you'll go into hypoglycemia. So, for diabetics, it has to be faced. You cannot just, stop all medicines. But those people who still have their pancreas function intact, and how we know pancreas function? Very simple. We measure the fasting insulin. If fasting insulin is high in a diabetic, then it is good news. In the sense that, that you still have reserve. There is still insulin resistance. And if you do all those lifestyle changes, your insulin falls. But for the rest of us who are not diabetics, the fasting insulin, as I told you, the grades in school, fasting insulin, the normal value is 3 to 24. So if somebody has got 24, they say it's good. No, it's not good. It's very bad for non-diabetics. Very bad for non-diabetics. So you must work on all this, and fasting insulin will come down and down and down and down. So mine is 3, for example. So it's come down to 3 with all these changes. So what is the implication of that? Because my fasting insulin is 3, I have so much of reserve cells in my pancreas. So almost you can say that somebody who's 3 for many years, you're never going to develop diabetes. Not going to, because there's so much of reserve cells in your pancreas. So it's not just a question of having normal value, but working constantly to improve that to an ideal value. So whether it's HbA1c, we say 5.6 is okay. It's not okay. It has to be low. Your fasting insulin has to be low. Your BMI has to be low. 25 is not normal BMI. You have to work. So we keep on working on these parameters to make them lower and lower.
So can I just answer that question about the fasting in patients with diabetes? First of all, I mean, I assume you're talking about type 2 diabetes. It also depends on what kind of medications they're on. If they are on a sulfonylurea or any of those, or insulin, yes, they need to make adjustments to their dose. It's one day of skipping their sulfonylurea is not going to kill them. So they can, it would be better to be safe than sorry in that situation. But there are so many other anti-hypoglycemic agents that are available today, like the DPP-4 inhibitors, metformin, or the SGLT2 inhibitors, which are not associated with hypoglycemia. So for those medications, it's really not required. I mean, we're talking about Ekadasi or something, which is a one time every 2 weeks. But then when you talk about patients who are fasting for Ramzan, for instance, that's a whole month. And even for them, the advice is the same, that if you're on an agent that can cause hypoglycemia, avoid it, cut the dose, whatever, but make sure that you're monitoring your glucose. But if you're on something like a GLP-1 receptor agonist, SGLT2 inhibitor, DPP-4 inhibitor, and or metformin, it's really not so much of a risk in that situation.
So, Dean Rajappa wants to ask a question. Go ahead, Dean. You can unmute yourself and speak in Tamil, no problem. Okay, looks like he wanted to ask a question, but he's not here anymore. So, do we have any other questions? Otherwise, we'll be winding up soon.
Yeah, ma'am.
Yes.
I'm Sushma Balasundram. I'm bariatric nutritionist, ma'am, from Coimbatore. So, keto diet and fasting and intermittent fasting. So, it's good for a post-operative bariatric surgery patient, ma'am.
Dr. Bose, would you like to take that question?
It's good for whom?
He wants to know whether patients who have had bariatric surgery, is it okay for them to do intermittent fasting and keto diet?
Frankly, I don't know. I think Patta would be the best person to answer that.
Actually, the very fact that somebody is bariatric surgery, that itself is some sort of a intermittent fasting, because they'll not be able to eat much and they'll eat maybe twice a day. And of course, I think this is an interesting part of it, because already patient in the bariatric, and on top of it, you want to go for intermittent fasting is, troubling the patient too much. But I think it shouldn't be any different from any normal individuals.
Yes, sir. They can go on that diet, sir. No harm, but only thing micronutrient thing has to be monitored. Otherwise, in intermittent fasting, micronutrient deficiency doesn't happen because it's done only once a day. So I think they can be put on the diet, sir, in my opinion, also, sir.
Okay, sir. Next question. Keto diet follow panna after 5 years or 10 years kapro, any other organs complications irka, sir?
Dr. Vijay Bose does not recommend keto diet at all. He says it's only for a short time. In case you want to lose weight rapidly, maybe you can do it. But he doesn't. He says that all three macro components have to be there in the diet. You only change the proportions and the good carbs and reduce the portion. He doesn't recommend keto diet at all.
Okay, sir. Okay, ma'am. Thank you, ma'am. Thank you very much, ma'am.
So does anyone have any other question or a comment? Amit, you want to say something?
Oh, this is a fantastic talk. I'm sorry I joined a bit late. The reason it becomes more important is neither the medical curriculum or the physicians at all levels all over the world are taught this thing. In fact, yesterday a patient gave me this comment which says, life is not a journey to the grave with the intention of arriving safely in a well-preserved body, but rather to skid in the broadside, thoroughly used up, totally worn out, and loudly proclaiming, wow, what a ride, by Hunter Thompson. So the whole concept is that in the Twitter world and the Facebook world, we can have discussions in a very small group without going deeply into it, looking at the evidence at it. So people visit us in the Mayo Clinic, they go to Cleveland Clinic, all these clinics. None of us really talk about this to an extent till the patient has some major end organ damage or a family history. Then they go to Dr. Bose and figure out that it's lifestyle modification. It is things that our forefathers did. As he said, thousands of years we've been doing it, which is so important. And all these whey proteins and all that, they're all dressed up like wonderful objects of desire in fancy bottles with fancy labels, like all these food articles, which has a lot of carbohydrates. I've never seen a cake which is not decorated with all kinds of fancy things with people dancing on the cake that pulls the kids towards it. So we are at a very difficult situation where there is an industry which has dedicated so much money into this, both the pharma industry as well as the
food
industry. And yet, at the end of it, when you listen to something that Dr. Bose is saying, it makes so much sense. And it said, my grandmother knew some of it, or somebody else knew some of it. So I don't know what the solution is. I'm an examiner at all level, the USMLE and Indian, none of them ask these questions. None of them ask what type of exercise should be done. As long as these days, as long as you're moving some body parts, that's called exercise. As long as you're eating something which has fancy name, keto or something, that's a good thing. So this revolution is long due and it's coming, and I'm very glad for Marvelous Medicine, not only to bring Dr. Bose once, but twice or thrice. It's probably as important as any of the talks that I have heard here. And I really congratulate him for the work he has done. I have some friends, Dr. Shashank Joshi is an endocrinologist and a dean right now of the Indian College of Physicians. I would strongly recommend Dr. Bose, if he's interested, I'll give his name. It needs wide range advertisement. People who are talking like that are felt to be zealots. They're felt to be, oh, they don't know what they're talking. Even in the hospitals, they're put, I don't know about Dr. Bose, but in our hospital, we'll put a person like Dr. Bose's stature in a small room, in an air-conditioned room, long away from where the cath lab is and oncology work is going on, and wherever our messed up lifestyle has got us into that situation. Because it's not sexy to give advice. You can't get too much money. I can't bill too much more than 200 or 300 rupees or dollars to get advice of valuable lifestyle advice. And yet Shah Rukh Khan and Amir Khan and all these fancy people, they don't go to us. They go to people like Dr. Bose and all that to figure out how the belly fat can go out, how the body can look good. So there's a complete disconnect between how medicine is gone and how we are awarding all these fancy degrees and what is actually life. So all the questions are brilliantly asked here. I'm so glad that you brought this topic up, and I'm more of a student than a learner, and it looks like a lot of years I've spent learning a whole bunch of bullshit, and only towards the later part of my career, like all of you, I'm like, they say, before, when you're in the fourth stage of life, before you go and leave your world and go to Himalayas, you finally figure out how to go and eat in Himalayas. So he said, intermittently eat ice cream and all those things. I am doing that, but I am beating my head. I've lost all my hair trying to figure out what the heck did I do all these years? Telling all the wrong advice to the patient, giving them lengthy prescriptions. And for when it comes to diet, I spend 2 seconds. I send it to my nurse or somebody else, go talk with the dietitian. But it is so very important to really deep dive into that and come up with it. I'm so glad that I looked at one point, you had 69 people on the call with one of the biggest groups that you have accumulated in Marvelous Medicine. Keep doing it. When you believe it, make it like a folk song. Give Padma Shri to Dr. Vijay Bose if he has not received something. Make him a hero. Instead of the politicians, he should be there and he should be telling all these things, which is so very important. 100% certified by me. I'm not of much value, but I can do that. Thank
So
you.
Dr. Bose is actually a joint replacement surgeon, but his passion is healthy lifestyle, and
I saw that. I mean,
he leads by example by doing it himself.
I don't know what his thing is. I'm told that if you gain 1 kilo weight, it puts to 4 kilo additional weight in your joints, in the knee joints. That's what Buddha Dev told me in one of his talks. So it's like, it's a tragic, yeah. What we do, what we don't do, he gets to replace. He, instead of getting rich by doing more joint replacement, he's telling people to lose weight so that he doesn't do joint replacements. So he's like a true doctor in the sense that prevention is number one for him.
Thank you everybody for joining, and actually we had more than 75 people, Amit. So it's good that such a topic has generated so much interest, and everybody has logged in and keenly participated in the discussion. I cannot thank you enough, Dr. Vijay Bose, and I will get back to you for another session on exercise sometime next, and we'll schedule it sometime next month. Thank you, Selvi and Vinita, for joining in the discussions, and thank you everybody who logged in. Next week, we will be actually doing our 25th episode of Marvelous Medicine, and all this started because of Patta Radhakrishna, and there have been several people who have been behind deciding the topics, finding speakers, and of course, those who log in to make the session so lively. So next week we'll again meet for another session of Marvelous Medicine at 8 o'clock on Thursday. Till then, good night, take care, and stay safe.